How do I know if my anatomy causes sleep apnea? Imagine lying in bed, struggling to breathe, and wondering if your own body is making it harder to get a good night's sleep. That's a common question for many people with sleep issues. Sleep apnea, especially obstructive sleep apnea, often happens because of certain physical features inside your mouth and throat. These features can narrow or block your airway when you are sleeping. So, how can you tell if your body's shape is behind your sleep problems? One clue is if you notice large tonsils or adenoids. These are tissues at the back of your throat that can be bigger than usual. When they are enlarged, they can block airflow, especially during sleep. This is more common in children but can happen in adults too. Another sign is if your nose doesn't seem straight. A deviated nasal septum, which is when the wall inside your nose is crooked, can make it harder to breathe through your nose. This often causes mouth breathing and can lead to airway collapse during sleep. Some people naturally have a narrow airway because of the shape of their face or jaw. If your jaw is small or set back, your tongue might fall backward and block your throat when you sleep. This is especially true if you have a recessed chin or an overbite. Soft tissues also play a role. If your tongue is larger than normal, or if your soft palate is thick, these can crowd your airway. Excess fat deposits around your neck can also squeeze the airway shut, which is common in people with obesity. Even if your anatomy is normal, your muscles might relax too much during sleep. This can cause the airway to collapse, but the underlying structure often makes this more likely. To find out if your body's shape is contributing, look for signs like loud snoring, choking, or gasping during sleep. Feeling very sleepy during the day is another warning sign. A doctor can help determine if your anatomy is part of the problem. They might check your mouth, throat, and jaw during a physical exam. Imaging tests like X-rays or CT scans can give a detailed look at your airway and jaw structure. Sometimes, a sleep study called a polysomnography is needed to see if your airway is closing during sleep. Certain habits from childhood, like mouth breathing, thumb sucking, or tongue tie, can also affect jaw growth and reduce airway size. If you think your body's shape might be causing your sleep issues, talking to a sleep specialist or an ear, nose, and throat doctor is a good step. They can suggest treatments such as dental devices that move your jaw forward, surgery to remove excess tissues, or continuous positive airway pressure therapy to keep your airway open all night.